and I'm Natalia Cajejas, and I'm a speech-language pathologist. We are all therapists here at FTC Kids, and we're here to answer some commonly asked questions regarding services in the private setting versus the school setting. And so the first thing we should cover on this topic is eligibility and the differences between a child qualifying for services in the school versus in a private setting. So we're going to dive into that first.
Yeah, so within a school setting, all of our kind of domains are really looking at how a child is performing within that academic realm. So for them to qualify for services, we're really looking at how they are functioning appropriately within their classroom setting, and if they're able to access their curriculum and what supports need to be put in place for that to be a success.
And regarding eligibility, they are looked at very differently within the education setting versus the outpatient setting. So students and children get evaluated, but the people doing the evaluations differ in each setting. So within the educational environment, you have the teachers, administration, and then the school-based therapists that are working there. And then in the outpatient setting, you often get a referral from a physician, or you as a parent come to us with a concern that we can evaluate on our own.
And while we're on the topic of evaluations, there are also certain requirements that differ between the two settings. And an example of that would be, in order for a child to qualify for services in a school setting, they would have to score 1.5 standard deviations below the mean on a standardized assessment. In the private setting, we also use standardized assessments to evaluate a child and see where they are, their current levels of performance. However, in order for them to qualify for services, there isn't a set number of standard deviations. They have to be below the norm. A child can qualify for services in an outpatient or private facility based on the need to strengthen any areas.
And a lot of that also comes from what your goals as a family are too. So in the outpatient setting, we can kind of address that more closely, whereas in the school setting, a lot of the concerns are coming from the teachers that the students are working with. Even though a child may be eligible and may be receiving services within the school setting, the school frequency and duration of services may not be enough to adequately meet all of your child's needs. And so this is where we seek outpatient services in addition to that. So although we are treating the same child, we have different models of service that we follow. We have different focuses of the interventions that we use, and we have different goals.
For example, when working with a child in the school setting, an example of a speech and language goal might be for the child to use grade level vocabulary to be able to participate in the curriculum class content. And so where that goal is focusing on meeting those common core standards, the same goal in a private setting might be just to develop age appropriate vocabulary so that that child can communicate with others, whether it be peers, parents, and we're really focusing on just the overall development of expressive language to be able to use across settings.
Similarly, an OT example kind of in the school setting, not only can we provide that one-on-one support, we can offer indirectly support your child's needs by offering accommodations and support in kind of their environmental modifications. So for example, in the school, if your student is having trouble with their written communication and their legibility, we can give different types of paper, we can offer the use of technology, or even just kind of work on that adaptive positioning to support their academic focus. While in the outpatient setting, we're kind of looking more at those underlying concerns as to why we are seeing those differences in their ability to perform such work. So whether that is their visual perceptual concerns, if it's something due to more of those primitive reflexes and their overall development and how they are moving along just developmentally wise, that's where kind of our focus would shift.
And then for PT within the educational setting, we're looking at, say, gait training, for example. of gait and ambulation, we're trying to see if a child has difficulty ambulating from one class to the next. So are they able to make it from one class to the next within that given period of time that they have? Can they carry their book bag up and down the stairs? That's the kind of, relevancy that we look for with those tasks. Whereas in the outpatient setting, if we're looking at gait training, I'm looking at their gait mechanics. I'm trying to help them attain a normal gait that isn't necessarily needed for everyday function, but it puts them beyond their actual potential, or brings them up to their full potential in that sense. And then similarly for like if a student gets injured, all three of us, right, in any way, we would be looking at what kind of adaptations do they need. So do they need adaptive seating? Do they need a communication device? That's what we look at in the school setting, whereas if they come to us in the outpatient setting here at FTC, we are trying to fully rehabilitate them to their full potential.
Therapists who also treat in a private setting, we understand that there is kind of a lot to dive into here. So we hope that just kind of by introducing ourselves and giving you kind of that gist on those commonly asked questions, this will help kind of ease those feelings about whether or not your child is qualifying for services within the school, as well as how you can reach out for outpatient services as well. So feel free to read more about this topic on our blog page at ftckids.com, and feel free to write in with any other questions.